My name is Péter Kéri. I represent GAMIAN Europe and the Awakenings Foundation, which is a community mental health center in Budapest. And if we are talking about the COVID pandemic situation, and we are talking about the community service system itself, we might think that there is an opposition between the situation, because how we can provide community services if we must face a pandemic like we had to face. And I must tell you that we were lucky as patients, as employees, as employers, because just immediately after the pandemic call, we started to reorganize the services what we have in Budapest, and we transferred all the services we gave to patients into the online sphere, into the online era. All the self-help groups, the peer support groups, the one-on-one treatments were transformed into an online presence. We did not know in the beginning how it will happen, it will be successful or not. But right now I can say that we did not feel that more relapses we experienced from patients at all. For example, I'm a part of many peer support groups, like voice hearers groups, like bipolar group, like trauma solution groups, and I have contact with them every week. And compared to the normal clinical setting, we have less relapses from patients than it is usual if I look around. And not only that, certainly on one hand, it is a horrible situation, but on the other hand, we had something to learn, that digital tools are here for us, for patients, to help each other and to cooperate with the professionals. And for example, we had to see that applications are useful tools for getting better. We started to promote applications, as Awakenings Foundation is pioneer in Hungary in production of mental health applications. And if we are talking about the online presence, it was good that we could cooperate on weekly basis, for example, with the international organizations, where we usually have only a conference 1 year. This situation gave us possibility to gather nearly every week, and we could produce fantastic materials for mental health patients. If you are talking about digitalization, if you are talking about using digital tools in the setting of mental health, it is not as easy as we could imagine, because many tools are not easy to use. The public relation, the communication concerning e-tools, digital tools in mental health is not really good. So if a patient with an Android mobile opens an application, he cannot be sure that it is a valid application, it is evidence-based, it is good enough. So we had tasks to provide good information to all our patients concerning the applications, the platforms on the internet. For example, we started to contribute a new magazine in Budapest. The name is Together, which is like a news magazine, but with the up-to-date news of the mental health, written by experts by experience and written by patients and professionals together. And additionally, we organized the so-called quarantine cafe in Hungary, which is something pioneer, a conference call every week where we meet experts by experiences, professionals uh, from all over the world, and we share information, best practices every time. And that's why I think at Awakenings we did not have setbacks too much, and we have positive aspects as well after this pandemia will end hopefully soon. So what I think we learned a lot during this pandemia, and we will incorporate all the work, all the efforts, all the cooperation in our future work, and we will horizontally share our knowledge in Europe with our partner organizations and within Hungary. And on one hand, this pandemia is something tragic, but on the other hand, we had many things to use in the future, and we have now patients who are familiar with tools they never used before, and that is something, some message, some good message for the future. Thank you very much.